Rapid Process Improvement Workshop, or RPIW, is a 5-day event that's focused on one process of work. And the idea is to bring together a team who uses standardized and rigorous tools during that week to make improvements to that process. The purpose is really to drive out waste in the process, so any inefficiencies, to get rid of that and to create standard tools to make the process flow smoother in the future.
It really leverages on the creativity of those people and lean principles and tools to redesign the process and make improvements for creating standard work.
It's not just our team in isolation making the changes. We're actually getting people who are part of the process or customers of the process saying, you need to be thinking about this, or this is not working for us, and so for everybody, making the process better so that we can move forward and be more effective.
I'm a cancer patient. I've been receiving treatment for 3 years, so I'm really understanding this now from the patient's perspective. It's so obvious to me that we need to change a lot of how our care is delivered to patients. So I get to share my experience with these people who are planning change, and I think it's really vital to hear from patients.
The RPIWs that are happening this week are focused on large-scale change initiatives. What we are doing is looking at the success of a recent large-scale change initiative that was undertaken in the Saskatchewan surgical program, and taking lessons learned from that and creating standard work that will help us to run future large-scale change initiatives.
But more specifically, we're looking at seniors, primary health care, mental health and addictions. Of course, safety is paramount, so we're looking both at the workplace and the patient for that. We're looking at infrastructure and IT and equipment, and we're looking at the budget. And we're also looking at the wait times from a patient getting referred from a GP to a specialist in diagnostics, and of course ED waits and patient flow, which is a huge undertaking, and I think it's really going to benefit from all of this good work.
The RPIW that we're developing will put in place tools and processes and really make it less stressful for staff that are responsible for putting those initiatives in place.
What I'm seeing is that people are considering all the possible factors about what's the evidence that we need to look at to change things. If we change something, what can go wrong? And who do we need to consult with to make sure that we've got all of the elements lined up?
What's nice about this is to look at, how has it been done in the past, asking people what was good and bad about it, and actually then taking that really rich information and starting to document it so that we can use that as our guide as we go forward, so we don't have to fumble around as much. And so we're kind of learning from our mistakes and keeping the really good stuff and just really improving the stuff that didn't work so well.
If you trust the process, by the end of the week it all comes together, and it's exciting to celebrate the results at the end of the week.